On February 19, 1994, a woman walked into Riverside General Hospital in California. She was weak, struggling to breathe, and clearly in pain. She was not famous, not wealthy, not a celebrity. She was simply Gloria Ramirez, mother of two, a wife, and a factory worker. But within a few hours, she would be remembered forever as the toxic lady. Gloria was only 31 years old, and she had already been given a devastating diagnosis: late-stage cervical cancer. That night, she was rushed to the emergency room after her heart began racing uncontrollably and her body temperature soared. Doctors and nurses immediately began emergency treatment, oxygen for fluids, and medication to stabilize her. But as they worked, they began to notice something deeply disturbing. Her skin looked strange, as if it was covered with an oily, almost greasy sheen. A faint garlicky odor hung in the air around her. Some described it as fruity, almost chemical. And when a nurse drew her blood, she recoiled. The sample gave off a strong smell of ammonia, and floating inside the syringe were unusual, crystal-like particles. Before anyone could process what was happening, chaos erupted. One nurse suddenly fainted to the floor. Another collapsed moments later. A doctor felt lightheaded, then experienced muscle spasms so violent she could not stand. Within minutes, nearly 24 hospital workers were struggling to breathe, vomiting, or passing out. The emergency room itself had become a scene of horror. The hospital declared an internal emergency. Patients were evacuated to the parking lot. Staff staggered outside, collapsing onto gurneys. All while inside, Gloria Ramirez lay dying. At 8:50 p.m., despite the medical team's efforts, she was pronounced dead. But for Riverside General, the nightmare had just begun. In total, 23 people fell ill that night, and 5 were hospitalized for days. Some suffered lasting health issues. The question was, what on earth happened? At first, many suspected mass hysteria, psychological chain reaction where fear spreads faster than any real toxin. But there were problems with that explanation. How could hallucination create ammonia-like odors, visible crystals in blood, and an oily sheen on the skin? A controversial theory soon emerged. Investigators suggested that Gloria might have been using dimethyl sulfoxide, or DMSO, a solvent sometimes used as an alternative pain reliever. In her weakened state, the DMSO could have built up in her system. When combined with oxygen administered in the hospital, it might have transformed into dimethyl sulfone, and under the ER's conditions, possibly into a highly toxic gas. But even this explanation was debated. Some scientists dismissed it as unlikely, while others pointed to inconsistencies in the evidence. Gloria's family, meanwhile, insisted she had never used strange chemicals at all. To them, the idea that she turned into a toxic weapon was both cruel and unbelievable, and so the case remains unsolved. To this day, Gloria Ramirez is remembered as the only patient in history said to have poisoned her caregivers without any deliberate action. Her story has baffled scientists, frightened doctors, and fascinated true crime and mystery lovers for 3 decades. Gloria's final night raises chilling questions. How could a human body become toxic to others? Was it an undiscovered chemical reaction, or simply the power of panic spreading like wildfire? Or was there something else, something we may never understand? What really happened in that hospital room remains a haunting puzzle, and it reminds us of a terrifying truth. Even with modern science, the human body can still hold deadly secrets. So, what do you think? Was Gloria Ramirez the victim of a bizarre chemical reaction, or was it mass hysteria that made her legendary? Comment your theories below, and do not forget to subscribe to Afterlife Mysteries Unsolved for more chilling real stories that defy explanation.